has made it that people are seated in one place almost all day. You are fixated
That's
on
true.
your
That's
computer,
true.
you are fixated on social media, you are fixated on your phone, and then technology can practically do everything for you. And aside that, you can automate things, so you don't have to be running around to get things done. And aside that, people work remotely now, so they don't have to go to work all the time to still get things done. So all this in a way has encouraged sedentary lifestyle and has made people, more less likely to move around. So that those are the chances. So if you are sedentary, you don't do exercises, you just sit in one place, your risk is high. So you can modify that if you don't want to have high blood pressure. Secondly, salt intake. In Nigeria, a lot of people consume a lot of salt. For them, while they are cooking, so much salt, and some people, it's even habitual. Even before they eat the food, they just pour salt in the food. It's just like routine for them, even before they start eating. So that's just what they are used to. Some add all
And that's wrong, right?
it's very wrong, because the more salt you eat, the more fluid you're going to retain. And the kind of hypertension we see in black people is fluid dependent. So the more salt you ingest, the more fluid retention you are likely going to have. So salt restriction is still something we can do. Our diet is part of what we can modify, so it's modifiable. Then people that take a lot of alcohol, alcoholism, nobody was born drinking alcohol, so it's a learned behavior. So if you keep drinking alcohol, it also puts you at risk of hypertension, puts you at risk of liver disease, puts you at risk of alcoholic cardiomyopathy. All sorts of things can happen just from you taking so much alcohol. And you can even be at risk of diabetes, because you can have pancreatitis and actually cause some problems with your pancreas. So it's very important that we realize that all these things can be changed. These are within our reach to do something about. Then smoking, of course, is also a risk factor, which is something that you can modify if you are disciplined enough and you seek the needed help that you need to break off from those addictions. People that are addicted to caffeine, all those two can disrupt their sleep patterns and affect.
When you say caffeine, what do you mean? Break it down.
Coffee beverages, caffeinated drinks, and most things that contain caffeine. Even some of these fizzy drinks too that are caffeinated, they can also, depending on how much you take them, they can also impact your health.
You wouldn't want to mention names. I know. It's okay.
Then, of course, we also have people that have high cholesterol diets. Westernization of the diet is a problem for both diabetes and hypertension. What we eat influences our health beyond what we actually, understand it to do. Because a lot of people, they are going with the current trends of things. Okay, what are the latest meals in town? Where's the new restaurants out there? Food fads and all that. Everybody wants to go with the drive of what's trending and all that. But some of the things we eat are not healthy. They give us the bad kind of fat that puts our hearts in danger, worsens our risk of cardiovascular diseases and even hypertension. So all these are things that we should look into. And our diets, of course, is also what we can modify. Like we said, it's in our hands to do it. These are the choices we make, our daily choices. We can do something about the diet. Then sleep and stress management is also something modifiable that has been attributed to development of high blood pressure. A lot of people are living under chronic stress. They wake up very early, come back late, no time for rest, no breaks, no vacations, no leisure time. Everything is all work, and always doing something. And when we talk of stress, we're not talking of only physical stress, we're also referring to mental stress and emotional stress.
Of course.
So all these things also impact our health. And after all, if you're not getting enough good sleep, how do you reset? How do you replenish your energy? How do you, wear off the stress of the previous day before getting it into a new day? So you now find out that a lot of people who have chronic stress, sleep disorders, are also at risk of developing high blood pressure. Then, of course, the big one, obesity, being overweight, is a big issue. A lot of people now are overweight, also from the same factors that I've talked about: sedentary lifestyle, not exercising, not watching their diet, alcoholism. These are the things that push people into being obese. And if you are obese, you will not be surprised if you have high blood pressure. You will not be surprised if you have diabetes. You will not be surprised if you have high cholesterol, and you're at risk of cardiovascular problems, stroke, even some cancers. You're predisposed to them just by virtue of being obese. So all these are important factors that we can do something about. We can take proactive steps, in managing these conditions that are within our reach. And know your limits when it comes to stress. We need to emphasize this for people in Lagos and in other urban cities. You are
Lagos, especially.
you are not a machine. You are not a robot. You are a human being. You need rest. You need to give yourself a break. You need to have healthy working hours. You need to know exactly when to work and when to say, okay, I've had enough for today. You need to know when it's time to get yourself the needed rest. Because if you are under that chronic stress, your stress hormones will be high. Your productivity will be affected. Even your immune system, you will be very vulnerable to falling ill. You will just pick up any infection that is in the air at any point in time. And you also notice that even your memory, your cognition, your concentration, everything starts to decline. And overall, your productivity at work and performance will be hindered. So it's very necessary that we take all these precautions if we know we want our health to serve us for longer. Because without you taking proactive steps, we've said it over and over on this program, if you don't take proactive steps, in ensuring that you promote your health and you maintain your health, it's only a matter of time. You just see everything collapse like a pack of cards. And unfortunately for some people, it's usually irredeemable, because it's either they die in the process or they have a stroke, and even the work that they've spent all their years working on will be the first to tell them that we don't think we need your services again, because they see you are no longer useful to them. The much they can do for you is pay you a visit a few times and
that's it.
And give you some money which can't make any difference in your life, and you are there to live the rest of your life with that predicament. So we really need to be very objective and take practical steps that would ensure that our well-being is secured, because ultimately it's our responsibility and it's in our hands. You can't blame anybody for what happens to you, because that company, no matter how, if you work for 40 years there, let them give you all the plaques and all the awards for meritorious service. If something goes wrong with you today and they notice that you are no longer functional and you cannot fit into that role anymore, you'll get a replacement in no time. And we need to tell ourselves the truth, because if something happens to you today, it's just 1 minute silence. We've seen it happen all the time. Everybody just feels sad for one day and they move on. Life must go on. But whoever is gone, that's the end. So we really need to tell ourselves the truth and be more active, or proactive when it comes to decision making that relates to our health.
In all of my shows, I like to relate whatever I'm discussing with the people, so they can feel it. I want to ask you, why do we have a child of, someone was telling me, I don't know if it's true though, a child of 10 years has diabetes?
Well, yeah, that's...
Have you seen that? Is it possible? Is it true?
Very, very possible.
10 years?
Absolutely. I've even seen 9 years who is diabetic. Yeah. Because there's what we call juvenile onset diabetes. That's type 1 diabetes. Type 1 diabetes is... Okay, so let's just talk about what diabetes is. So diabetes is elevated blood sugar. And you find out that the way your body breaks down sugar and utilizes sugar, there's a problem with it. So rather than the body making use of the sugar is more in the blood than in the cells where it's supposed to be used. So there's a hormone called insulin that is like an interface, is secreted by the pancreas. So once you eat and your sugar goes up, or you take something that contains sugar, of course your blood sugar goes up. But because your pancreas is working well and producing enough insulin will just drive the excess sugar from your blood into your cells where they are to be utilized. But if something is wrong with that channel, either your pancreas isn't producing insulin enough, or it's not producing insulin at all, then you'll find out that there will be high sugar. And that's type 1 diabetes, because
that's
type 1 insulin not produced at all or not produced enough. So it's an insulin deficiency problem. But for people who have type 2 diabetes, insulin deficiency is not the problem. There's insulin, but the way the body responds to insulin is faulty. So the receptors are not acting, the way it is expected, though insulin is present. So you now have type 2 diabetes. Then the third type of diabetes is the type you have in pregnancy, gestational diabetes, where a woman who was previously normal finds out that after pregnancy her sugar starts going up, and they may start detecting glucose in her urine also. So all those are indicating gestational diabetes. So for a child, we've noticed that type 1 diabetes is common in children. That's why they call it juvenile onset diabetes. So most children most likely do have type 1 diabetes. But now we're beginning to see type 2 diabetes in children too. Why? Because of obesity. So the main reason why I think most children are likely to develop diabetes in our time and age is because of overfeeding, because of being overweight, and obesity. Because now a lot of parents are permissive. Your child wants to eat this because other children are eating this. Your child wants to go to this fast food because there's something special that they produce, and then a lot of children are crazy about it. There are certain kind of ice creams and toppings and all that children love, and you are just permissive. You just let them take anything they want. Taking up calories. They are not burning it as much as they should. And before you know it, you see that these children, because of their high sugar content food and because of their lifestyle also, and how the whole family dynamics is, you now find out that they become obese. I've seen a child who is just 12 years old, and I'm not exaggerating. She weighs over 100 kg.
What?
I think she weighs like 110, if I'm not mistaken. And she's 12.
How old you got it?
She's 12.
12 years.
Absolutely. Yeah.
Is that possible?
The only thing that will make you know she's a child is her school uniform. Because you just think maybe somebody is acting somewhere, somebody is trying to act like a child wearing this kind of school uniform, but this is somebody who looks like a fully grown adult, but she's just a child. It's when she starts talking to you that you actually, this person is just a child,
What?
So will you be surprised if that kind of person develops diabetes? Would you be surprised if blood pressure keeps going up? Would you be surprised if before the age of 20, this person can't do any active sports or starts having arthritis of the knees because those are the weight-bearing parts of your body? You won't be surprised, because there will be all sorts of health complications. And what would happen to the person by the time the person is 30 and 40 and all that? So it is not in our interest to encourage our children to start being overweight or be addicted to foods that are not healthy. It is during childhood that parents should enforce good nutrition. The schools too should enforce quality, nourishing, balanced diet to these children. It is not everything that tastes nice in your mouth or on your tongue that is actually beneficial to your body. We need to be frank with ourselves. The fact that something tastes good, or the aroma is pleasant, or is attractive to us, doesn't mean it is nourishing our body. We need to start eating with intention. That this thing I'm going to eat, what purpose is it going to serve in my body? How is it going to benefit my body? What nourishment am I going to derive from this food? And is this the best for me, or do I have better options? So it goes beyond what taste, and it goes beyond sensation. It goes beyond what we feel and what we perceive. It is what benefits do we derive from this. So if we don't prioritize benefits and nutrition over what our cravings are, then we'll get into trouble.
I also notice, talking about BP now, I also notice how people, I don't know have a percentage to it, but then a lot of persons are into using one BP drug or the other. Men and women, every day you see them gulping one drug, or when you find out it is BP, hypertension.
Absolutely.
How now?
Yeah, correct. I was at an outreach yesterday.
Why?
We organized an outreach in a community. A lot of people check their BP, and everybody, hypertension. And then you ask them, is this your first time of realizing you're hypertensive? Some will tell you it's their first time. Some will tell you, no, it's not their first time. Okay, if it's not your first time, then what have you been doing about it? They just laugh and say, well, that was 6 months ago when they told me that I had it, but, I stopped using the drugs. That is the error. You cannot stop using a drug a doctor has placed you on. For the doctor to deem it fit that you need that medication, then you should not take yourself off that medication without your doctor's knowledge. You need to carry your doctor along, with every decision you make. Because you taking yourself off the medication now, and your BP is high, and not forgetting that it's a silent killer. You feel normal. You feel okay. You don't feel sick. You don't feel anything. You go about your normal work, and your BP is quite elevated. So if you are waiting for symptoms, you may not find those symptoms that will tell you your BP is high. You will feel absolutely normal, but you are in danger already. Your kidneys are in danger. You can have a stroke. You can have sudden cardiac arrest. You can have heart failure. You can have practically anything that you don't want. And unfortunately, all the complications from uncontrolled blood pressure are horrible, horrible complications. So if something to me, I think it's just logical, right? That if anything does not give you signs and symptoms and is potentially dangerous, you should be looking out for it every day. Because you're not feeling anything, it's not showing you any sign, then you should be monitoring it every day, because you may feel normal and the thing is still there. So the more reason why people should be checking their blood pressure. So I don't understand how an adult now living in this day and age would tell you that they don't remember the last time they checked their blood pressure, or they don't remember the last time they checked their blood sugar, and knowing fully well that one of their parents is living with the condition or has died from the condition, or they have a sibling with that condition, or they themselves are overweight, or they know they drink alcohol or smoke, or they know their sleep is not great, and yet they don't care about these things. These are like waiting for a disaster to happen and then looking for a miracle when the disaster has happened. A lot of people have kidney problems today resulting from these two conditions that we mentioned, diabetes and hypertension. The problem is not having the disease. The problem is leaving them uncontrolled. Because a lot of people have this disease and they are perfectly under control, both conditions. And you will never know unless they tell you, because they are compliant with their treatment, they are compliant with the diets recommended for them, they are going for their exercises, they are maintaining a healthy weight, they are quitting all sorts of detrimental habits that are not good for their health.
But the question is, why are these two linked? Diabetes, especially we get diabetes, sometimes in most occasions must have hypertension. Why?
Because they have similar risk factors. Just like we said, being obese, somebody who is big on the big side, your heart is just the size of your fist. Now you have high cholesterol to plugging all your arteries and all that. You have high blood pressure. The same body fat that you have is making you have insulin resistance, because you are obese. You have so much body surface area and fat and everything. You now have insulin resistance because that obesity alone is a risk factor for both hypertension and diabetes. So that's why anybody who is on the big side should be expecting the two. It's just a matter of time. So they have similar risk factors. Then also, they both have a genetic trend in families. So if you know you have a family history of both conditions and you are not on the lookout for it, it is not that you're expecting something bad to happen to you. It is just that you are being proactive. If you know something runs in your family, especially your parents or your siblings have it, don't wait until it happens to you. Just know you have to start checking out some important things, because by you being in that family, you already have an asterisk on you for that condition. So it now depends on your choices and your decisions and your discipline to follow consistently those healthy lifestyle choices so that you can escape that condition. We have some people that just because they are born into that family doesn't necessarily mean they would have it, because they took proactive steps and they stayed disciplined. You see some people, they go to the gym. It's not just that they just like exercising. It's because they are running away from something. They don't want certain things to happen to them. They want a particular trend to stop on them. You shouldn't exceed them. So it's necessary we watch our diets. It's not everything our tongue craves for that we should always look for. It is not all the time that you feel like taking something that it means it's good for you. We need to have that discipline, because life is just one. And like we say, when these complications start, kidney problem is no joke. Dialysis is not cheap. Kidney transplants is even almost out of reach for most people in terms of what it takes, finding a donor and the costs associated with it. So we need to make quality choices.
So how do we now monitor our blood sugar? How do we now make sure that we don't the blood sugar doesn't exceed a particular level or something? How do we watch out for it?
It's very simple, because you can do some simple tests like the fasting blood sugar, where you check your blood sugar early in the morning before you have your meal. At least you fasted for about 8 to 10 hours, not exceeding that, and then
not exceeding that.
Yes.
Oh, okay.
And then you have your sugar checked. It should be between 70 and 100. Some say 70 to 110, but I prefer keeping it 70 to 100, because if you have around that tells you, okay, your sugar is well regulated. But by the time you're getting above 100, between 100 and 120, you say you are in a pre-diabetic state or having impaired glucose, because it means that you're just on the edge. If you don't, so being on the edge means that we can save you, or you can tip into diabetes. depending on your choices. Nobody will place you on any drugs at that point. So it's mainly diet and lifestyle. So it's up to you to start watching your diet. It's up to you to start exercising. It's up to you to start losing the excess weight and maintaining it. I've seen people that have reversed it and their sugar became normal again. But you now find people, when the fasting blood sugar crosses 126, that is diabetes. That means you have not eaten anything and your sugar is reading 126. Like you have not eaten anything.
If you can't chop, uncle.
If you go, exactly the point. And then we eat eba. What are the foods we eat? Eba, fufu, semo, yam, rice. And then we take Pepsi, you know,
to
and
put
the
it
rest of
down.
them.
Oh
Yeah.
God, try.
Something sweet and delicious to just gulp it all down. And then all these yogurts, you know, sweetened yogurts, you know, we just gulp it all down. And then, you know, people, it's just as they are eating this, they are eating that. Somebody is going with a snack, pastry, is puff there, is this one there. Just as it goes, donuts,
Wow.
meat pie, you know, pizza, anything available. You know, you just eat, gulp everything down, and then you now wonder why your sugar is 400 or 500.
You know, I'm always scared when I see people taking, eating cake. You know, this normal cake, right? You know, it used to be very sweet. I run from cake. I don't know why. Because of that sugar thing.
Because
you know?
it's
then you see someone eating cake and then gulping a bottle of some
all
of
these
these
fizzy drinks,
carbonated drinks, gulping it with all pleasure.
gulping it, and some people take
You know.
a number of bottles a day, not just one. They take several within a 24-hour period, because they tell you that, you see, when I take it, that's when my energy comes. I'm able to, you know, to move and to get things done and everything.
I'm sure someone listening to us will tell you, I know somebody who takes that thing every day, at least 2.
Of course.
And the person is smart, agile, see the life and everything.
Of course.
I beg you, Jerry.
Of course, I beg you. And then you see, I think for me, I think it's important we mention this, that I don't know where this notion came from, and I hear it amongst Nigerians. Initially, I found it funny, but now it's not funny anymore because of some of the things we're seeing. When they say something must kill a man, but you don't have to die stupidly now. Even
Okay.
if something is going to kill you, let it be that you did your part to live.
Okay.
You know, because you can't say because something will kill a man, then you go to the expressway and just lie on the ground and say, this is one way of dying now. Let something just kill me. Anybody can die in any form. Yes, anybody can die, but as a human and a responsible person, be found doing something that encourages your well-being and improves your quality of life. Because that's your health that you're not taking care of. When the real disaster comes with your health, you will look for that money to take care of yourself. And you would even go and get loans. And some people end up selling properties, even advocating for support from external sources. And despite all, it is irreversible. And the damage cannot be corrected, and they still die in the process. So who loses in the end?
Wow.
Why not let us make healthy life choices and let us be able to enjoy what we have worked for? And let us be around for our families for a long time. And we don't want to be seeing our loved ones in bed in the hospital, either having stroke, they cannot communicate again, on dialysis machine. That is not what anybody prays for. We want our loved ones to be around, healthy and normal, and we enjoy their company. We all know human beings, nobody will be here forever. But it's not by how long you live. It is the quality of your life. We don't even want you to now. I don't think anybody even wants to live to be 200 years or 250 years, because all the people you know that you grew up with, they are all, in fact, everybody you know, they will all be gone by the time you are celebrating your 200th birthday. Every single person you know will not exist again. So it is not about how living long.
To avoid diabetes, what should we stop doing or start doing?
To avoid diabetes, first I would advise, what is the trend in your family? Do you have a positive family history? If you do, then you have to take these instructions very seriously. If you know there's a trend in your family, then being overweight is not for you. Alcohol is not for you. Sedentary lifestyle is not in your interest. And if you know that you're always eating only carbohydrate foods mainly, and you don't do vegetables, you don't include other classes of food, you do westernized diets, you do pastries, you do the ice creams, you do all the sugary things and all the sweet things, it is not going to be in your best interest, because you are only trying to activate what is already there, that is silent, that is just watching you, that okay, should I come on or I should not, depending on how this person manages his life. So it will be in your best interest, if there's a family history, for you to make sure that you are always on top of your game with your health. In terms of frequent wellness checks, you go for your sugar checks periodically. You will make sure you maintain a healthy weight. You will make sure that your diet is well balanced. You will make sure that the moment you notice some red flags that are indicating your sugar is going up, you run to the hospital. It is not agbo. It is not one mixture that will bring down your sugar. You go and see your doctor. And what are these red flags that can indicate that your sugar is going up? Luckily for diabetes, you will have some symptoms, not like hypertension that is silent, you don't even know anything. But for diabetes, it will give you some signs. You will be peeing more than usual, frequent urination,
Okay.
and each time you go to urinate, there will be so much volume of urine that you're passing out. Then you will notice that you're feeling thirsty all the time. You want to drink water, your body calling for water frequently. You may also notice your appetite has increased. Your body is calling for more food all the time. You get hungry by the hour. Then you may notice that you're losing weight without explanation. Then you may notice that you're having frequent infections. You have a boil here in your armpit today, then the boil is in your ear the next moment, then the boil is on your eyelid, then the boil is somewhere again, and you're wondering, why are you having recurrent boils? You need to check your sugar. If you notice that you're having numbness in your hands and feet, or it looks like you're standing on pins and needles, your nerves may be affected from the high sugar. If you have not checked your sugar, you go and check your sugar, especially when you have a family history. Then, of course, if you're a man, you're beginning to have erectile dysfunction, go and check your sugar. It may be a problem. You may be diabetic, especially if you have a positive family history and you are hypertensive. And you have a positive family history and you are an alcoholic. You drink a lot of alcohol. You need to go and screen for your sugar. Then ultimately, you have a wound that does not heal. Those are complications that come from diabetes. So you just find out this wound, I should have healed. What's going on? It's getting infected, it's spreading, all those things. You need to go and check your sugar. All these may be signs that the diabetes has even been there for long. It's not even diabetes that is just starting, because these are complications that you have missed out on the diabetes. You didn't watch out for it. You've not been going for checks. But these are things that can signal you to a possibility of having diabetes.
All right, everyone, feel free to join the conversation. Okay, like I said, if you have a question, just push it across. Okay, and let's just have it on YouTube or WhatsApp. The WhatsApp number is 081 717 56338. 081 717 56338. I'm not taking calls. Okay, I only ask you to send a text message, or rather, WhatsApp, not text message, WhatsApp message to the number 081 717 56338. You can also drop it for me on YouTube. YouTube is VOP 90.3 FM. Okay, thank you so much. Now, Doc, all of this things you mentioned, is this same with BP?
Well,
this prevention thing you mentioned, is this same with BP?
Essentially, because for BP, the prevention, of course, is you lose weight if you are overweight. You prevent sedentary lifestyle by exercising regularly, maintaining good circulation. Then number 3, for BP, reduce your salt intake. That's very important. Salt and MSG, all the seasonings, all those things that we add to food to flavor it. We call them those monosodium glutamate, all those seasonings. You need to minimize them because they are high in sodium and they would only retain more fluid in your body. And ultimately, the kind of fatty foods you eat, everything fried this, fried that, high cholesterol, the kind of oil you use in cooking. There are some types of oils that we see now that, once you just leave it in a bottle and just observe it, it just solidifies and looks like wax. And that is what people use to cook. That's what people eat. It will end up clogging their arteries. It will end up increasing their cardiovascular problems and possibility of strokes and all that. So it's very essential that the kind of oil that you use in cooking, very, very essential. Cut out the caffeinated drinks, especially, or anything that has caffeine. If you take black coffee and you are really addicted to it, because some people can't function without that coffee. If you take it away from them, it's like all hell has been let loose. So all those are things that you need to also watch. And then basically your quality of sleep. If you're dealing with hypertension and you're not sleeping well, it is a big issue. You need to sort out your sleep
It's a big
problems.
risk.
Yes, you need to sort out your sleep problems. You need to find out, why are you not sleeping? You need to find out, do you have a problem with initiating sleep, that is falling asleep, is that the problem, or maintaining sleep, that you don't stay asleep, because once you wake up you can't go back to sleep. You need to discuss this with your doctor, and your doctor would give you the right guidance. For some people, they think, oh, it's only sleeping pills, but we don't always advise sleeping pills, because sometimes we've noticed that this sleep problems goes beyond you just taking sleeping pills. There are some deep-seated problems that the person is not tackling. This is actually causing the sleep. For some sleep problems, for some people it is grief that they've not actually overcome, something that's happened to them, a traumatic event that they've not really surmounted, that is actually presenting as lack of sleep. For some people it's anxiety. They have anxiety disorders. A lot of people are always having panic attacks, always anxious. Not just the normal anxiety that people have normally, but it is now really a kind of anxiety that makes them almost not functional. When the anxiety comes, it's like they're out of control. They can't control whatever is happening to them. And these are real conditions that can be managed medically. You can see a psychologist, even in some cases a psychiatrist may be needed. It doesn't mean that they are running mad. It just means that they need professional help to manage those conditions. And of course, depression. When there is depression, sleep becomes a problem. For some people, it's either they sleep too much or they don't sleep at all. And if that continues, it's a problem. So if you're not getting enough sleep, your blood pressure is likely going to have problems with control. So you need to sort it out, whether it's an emotional factor or physical factor, or because there's a factory beside your house that will not let you sleep because of the noise, or because of the light, or because of the temperature, or whatever is causing you not to sleep in your environment. You need to be able to pinpoint it and be able to do something about it. Then, of course, stress management. We can't overemphasize it. Know your limits. Work has boundary. You are not working 24 hours. Know when your work hours are, and know when your rest hours should be. Find a hobby, something interesting that relaxes you. Meditation, prayer, music, reading, writing, whatever, TV, movies, whatever it is, or good social interactions with people around you. Go and see your best friends, let them visit you, go on vacations, whatever eases out stress from you. You need to be doing that. It's part of your treatment. That's why some people go to the spa, some people go for massage. All those massage therapies is to distress you, to make sure that that stress leaves you. You're in a relaxed state, because it's good for your mental and emotional health as well as your physical health.
All right, everyone, I'll read your questions, okay? I'll read all of your messages. Keep them coming. 081, that's a WhatsApp number. And when you send in your WhatsApp, or in case you're watching me or watching us on YouTube, you can just drop it in the comment section, okay? The WhatsApp number is 081 717 56338. 081 717 56338. YouTube VOP 90.3 FM. Okay, feel free to join the conversation. All right, I will go on a very, very short break, and when I return, I'll start reading out your messages. Okay, just be as brief as possible. I'll be right back.
Attention, young professionals, business owners, and first-time investors. Are you tired of hearing about real estate scams, struggling to raise funds, or wondering how to profit in today's property market? The Naija Landlord Summit 2025 is your chance to learn from experts, connect with decision makers, and discover how to grow your wealth through real estate. Join us on Saturday, 1st November at Airport Golden Tulip Hotel, International Airport Road, Lagos, from 10 a.m. Highlights, explosive sessions on real estate investments, explore fundings and mortgage options, understand government housing policies, network with developers, banks and investors, access exhibitions and insider opportunities. Participation fee 50,000 naira only. Call or WhatsApp 0707 115 4297 0707 115 4297 to register. The Naija Landlord Summit 2025. Knowledge, networking, wealth creation. Powered by by VOP 90.3 FM.
All right, welcome back, everyone. The doctor is set to answer your questions. Question number one, Doc, because questions are coming in. One thing we don't also talk about is low blood pressure. Do you understand?
Mm-hmm.
We all understand high BP, but low BP is something we also have to check on. This person is asking, how do you know that you have low blood pressure?
Okay, like high blood pressure, we defined it as persistently elevated blood pressure, and we gave the ranges of the two values. But for low blood pressure, your blood pressure should be minimum of 90/60. 90 for the upper reading, 60 for the lower reading. Anything below that is hypotension, is low blood pressure. For some people, 90/60 is fine for them. For some people, 100/70 is fine for them. They're not dizzy, they are functional, everything is good. Some people are that way. But when you find out that your blood pressure is lower than 90/60 and you're feeling faint, you're feeling lightheaded, you're feeling dizzy, you're feeling fatigued or lethargic, you should go to a hospital, because that is potentially also dangerous. Because if your blood pressure is low, that means that even the perfusion of your organs will be compromised, the circulation and all that. And it's also important that I mentioned that low blood pressure can also be seen in a situation where somebody is losing blood. Either hemorrhage, bleeding, heavy blood loss. You can have low blood pressure. Sometimes there's some kind of bleeding that you have that are not obvious externally. You can have an internal bleeding. You just notice the person is in a state of shock. The blood pressure is very, very low, but you will notice that the heart rate, the pulse rate will be increasing. So that tells you it's possibly the person is either having some kind of bleeding that you're not noticing, or even in some cases, it could be what we call septic shock. In septic shock, when you have an overwhelming infection, you can also have low blood pressure, the blood pressure crashing below what it's supposed to be, and it is an emergency. So if you notice that your blood pressure drops below 90/60 and you're feeling faint, feeling dizzy, and you feel unwell, or you know that something is amiss, please go to the hospital. And normally these are not things that we would say, okay, these are medications you would take at home for low blood pressure. Low blood pressure, if you have it and it's now symptomatic, like all the symptoms I've mentioned, you go to the hospital. They're going to resuscitate you with fluids, and if necessary, they can now give you some IVs that can help you raise your blood pressure. So this is not the time to take anything you don't know at home, hoping that it will raise your blood pressure.
You see, now this one they call life no balance. He high, they say too high. He low, they say too
everything
low. Where we won't go.
No, but everything in the body is like that. Even sugar, blood sugar is too high is a problem. It's too low is a problem. If your sugar is too high, it's diabetes. If your sugar is too low, you'll be fainting, you'll be tired, you'll be shaking, tremors, sweating, palpitating. All those things are signs also, even confused, possibly being unconscious, or even enter a coma if the sugar is too low. So you can see that everything in the body has a range, a reference range. It must be between this and not exceeding this. So that's how it is.
How long does someone stay to check for diabetes? How long
does someone stay
before you check?
When you say
diabetes?
Stay, I'm trying to understand
That's
what
the
that
question.
stay
That's what
means.
the person is saying.
So
Emmanuel from Sele.
does it mean how many hours do you?
How long?
I think we mentioned that if you are checking your fasting blood sugar, at least 8 to 10 hours of fasting.
No, not that. Maybe let's say days. How many days interval, or how many weeks, or how many months interval?
If you are not a
and then
diabetic patient, you don't have diabetes in your family, for instance, or you have gone for your wellness check, and they say you don't have diabetes, you just wait for your next wellness check, and making sure that the fact that they gave you a clean slate doesn't give you the license to go and drink all the ice cream in Lagos, for instance. And doesn't mean you can be drinking alcohol or just throw caution to the wind. It means that every time you go for a wellness check, I tell people the best response you should have to a good report is not that, thank God, though, my report is good, though, I can eat anything, I have free license. Rather, the response should be, thank God, I'm doing well, I'm doing something right. I'm doing something right.
Okay.
Thank God I'm doing something right, and I need to continue what I'm doing. I need to maintain what I'm doing. I need to maintain what I'm doing. I'm on the right track. It should just encourage you that you're doing something correctly.
Doctor, you know why I smiled? The messages popping in right now. Sorry, they are above 50. Yes. So, and I wonder the time I'll have to yeah. Well, let's just see how we can quickly answer them. Okay, doctor, what of when your sugar levels are at 65% at the age of 54?
65%?
Is that 67 rather? 67
yes.
At the age of 54.
67, that's your fasting blood sugar.
Probably, I don't know.
And so if it's your fasting blood sugar that is 67 milligram per DL, that's it. It's okay. It's not bad. You are not diabetic, obviously. You are not diabetic, so that's still an acceptable range. So that's fine. But I would encourage you to always go for your wellness check. You don't just take one report and the next one will be in 3 years or 5 years. So it's something you should be doing, periodically. But that's a good report.
Okay, my question is, what type of drinks? This is Abdul Salam from Badagry. What type of drink are advisable to take in order to avoid diabetes?
Drink. My
brother, go and drink water. Right?
Thank you. Yeah, you can't be wrong because 70% of your body is made up of water. Water is the best hydrating agent, so you can't be wrong to drink water, like you said. And if you're thinking of drink, please do your fruit juices. Do something natural. That will be more in your best interest. And if you are overweight, you can, of course, you have to stay off all those sugary things because they would only make you pound up more calories. And alcohol is almost a no-no if you know you don't want diabetes. So alcohol is not what you should go about because it will only add calories to you, give you truncal obesity, and also give you pancreatitis. If you drink a lot of it, your pancreas that produces the insulin will become inflamed, becomes a problem with sugar control.
I noticed that when I'm talking, my mouth will be bending to my left side. My right side eyes has been, dripping water for like 2 months now. David from Ipaja. What could that be?
I hope you don't have Bell's palsy, because Bell's palsy is a type of one-sided facial palsy, almost like paralysis of the facial nerve, that makes, one side droop, and it's something that you should look into. You should see a neurologist. A neurologist will do an assessment, a thorough assessment, and may place you on steroids if it is Bell's palsy. And then it may also send you for physiotherapy to help you restructure your face, so that the muscles of your face will be exercised and they can regain their normal function. And when you quickly intervene, the outcomes are usually better. So time is of the essence.
Okay. Let me look at this message again. Okay, yes, I have a question. I went to do X-ray, chest X-ray, right? The results show that I have tuberculosis, which the doctor gave some medication, and I'm using it now. Can tuberculosis be treated?
Yeah, tuberculosis can be treated, but you should note that it's a long-term treatment. You can treat between 6 months and 9 months. It may take you that long to complete your treatment, and the drugs are not just one medication. It's a combination of some important medications that you need to be taking every day, and it's very important that you know that tuberculosis is an infectious condition that can spread in your household, so you may need to take extra precautions, and people around you who have, who are in close proximity to you must also go and get tested, to know if
the one we generally call TB.
TB, yes, the one we call TB, exactly. So you need to let people around you to, get tested. You make sure that your house is well ventilated. You prevent overcrowding. And when you cough, you cover your mouth when you cough. And when you do produce sputum, you make sure that you throw it in a trash that has a lid that is well covered. Okay. So it's very important that you while you are taking care of yourself, you also are considerate of other people around you. So I advise that people who are close to you should also get screened, but note that it is treatable, but it is not 3-day treatment. It is not 1-week treatment. You may need to be treated for 6 to 9 months for a proper recovery.
Okay. Well, Nelson is okay, mainland, right? Okay. Doctor, I checked my blood sugar levels last month and it's 106, but in the daytime I urinate more than 7 times, but in the night I urinate 2 or 3 times.
Okay, I don't know what your age is. I believe it's a man. But if you are over the age of 40, I advise that you go check your prostate to make sure that you are not having prostate enlargement, which the test we call the PSA, and possibly do a prostate scan just to check the prostate size. If you're having obstructive symptoms from an enlarged prostate, your bladder is not going to empty completely and you're going to be having residual urine in your bladder. So that would make you have that frequent urge to go to pee all the time. It's also important for you to also do a urine test. Since your sugar is not bad, you may need to do a urine test. A urinalysis, we check for nitrites in your urine and then other things that point to a urinary tract infection, or you do a urine culture to identify any causative organism causing a UTI.
This person says, I'm having frequent urination for 2 nights now, but I have checked my blood sugar and it is not above 85. What might be the reason?
Frequent urination is still the same as I just answered. If you're a man, go check your PSA. If you're above 40, do a urinalysis, do a urine culture. You may have a urinary tract infection.
Madam Florence sent a message. He said, good morning, doc. My husband went to the hospital and asked the doctor to check his blood sugar, but the doctor said that, who told you have blood sugar? Who told you your blood sugar is high? But instead, he was treating him malaria and typhoid until he was rushed to another hospital from work and discovered that the blood sugar was high. In the process of treating him, he gave up.
Oh, no.
So at times, when you suggest a test to some doctors, they will counter you and ask you if you are teaching them their job. Madam Florence is the one who sent this message.
Yeah, so for me, I am so sorry for what happened. I accept my condolences. But I would say that everybody in this day and age, even if you are not a doctor, you are not a medical person, please know about the conditions you are managing. Read a little, have an idea of what it is. There's no harm in you having a discussion with your doctor and having some suggestions to your doctor, because you know your own health better than anybody else. The doctor works with the information you give him. So if you I'm sure if you told the doctor, for instance, that there's a family history of diabetes, or this person has had a history of high sugar, or has a sibling dealing with high sugar, or something important that is pointing to diabetes, he is not going to deny you that test. And of course, our medical practitioners should also be more intentional, and give a listening ear to patients. Sometimes there's something you call a patient's intuition, and even a doctor has their own intuition too. Sometimes I see a patient and I tell a patient to go and run a particular test, and the patient thinks, why are you asking for this test? But there's just something nudging you that there's something to be checked. And the results will come out and the patient will come back to say, thank you, I'm happy that I listened to you, that I checked, because I wouldn't have known I had this thing if you did not push me to go for this test. And also, the doctor should listen to a patient. When a patient feels something is off or something is wrong, or their relatives are, raising a concern, it's part of our profession to be good listeners, show empathy, and then listen to them and give them the right guidance they need. It doesn't cost you anything to check somebody's sugar. That death was preventable. It shouldn't have happened. We need to do better, even as professionals.
The doctor is very knowledgeable. I enjoy him. My question is, I can't sleep at night. I've heard all what you said concerning sleeplessness. Speak more on it, please. Tunde is the one speaking. Sleeplessness.
Well, that's a very common problem also. But I would advise that if you want to sleep well, you need to make sure that your environment, physical factors in terms of illumination, how bright the place is, the noise in the environment, the sound in the environment, the temperature. Extremes of temperature can affect your sleep. If it's too hot, if it's too cold, can also affect your quality of sleep. Then also, I would advise you to look into your emotional life and your mental state also. Are you under any stress? Are you going through any anxiety? Are you preparing for any major events, any exams, any ceremonies coming up? Are you expecting something? All those things they can affect your quality of sleep.
Okay.
But it's important that you do the 3-2-1 rule. 3 hours before bedtime, you don't eat anything, you don't have late dinners. 2 hours before bedtime, you don't drink anything like liquid that will be making you pee at night. 1 hour before your bedtime, no screen time, computers, phones, and everything. Stay away and make sure your environment is cozy and dark to encourage your sleep.
Okay. VOPFM. Somebody said, make I ask you, which school you go first? It's a VOPFM. Your medical doctor this morning is excellent. My greetings to him, Frank from Mayo, but that's all he's got to say anyway.
Oh, thank you so much.
And then,
okay, and I'll answer the question. University of Lagos.
Oh, really?
College of
You
Medicine
don't
of
do,
University
don't
of
do.
Lagos.
Drop your hand.
Thank you, sir.
Okay.
Thank you.
Okay. Please, yeah, is there any level of hernia that can be that cannot be operated? T-boy from Ojo Alaba.
Well, hernias, they're just essentially a part of your bowels or a viscous that is protruding through an abdominal defect. So it can occur anywhere. You can have an umbilical hernia around your navel. You can have inguinal hernia in your groin. Excuse me. You can also have diaphragmatic hernia. Depends on the type of hernia you're talking about. There are certain hernias that we are not rushing to go and do a surgery. But hernias, are something that we don't take lightly to, because if it gets trapped or strangulated and blood supply to that part of the bowel is cut off, becomes gangrenous, you lose that aspect of your bowel. So if you are having a hernia, the best thing for you to do is, if you have confirmed it's a hernia, you need to go and see a general surgeon. The general surgeon does some physical examinations on you and then finds out if the hernia is reducible, meaning that if they apply pressure or press it down, it goes back in on its own, or is it reducible, and he now determines whether it's operable or not. So it's a general surgeon that would actually determine, this is the type we want to take for surgery, or this is the type we're not going to operate.
Having severe abdominal pain, is it also a symptom of diabetes?
Severe abdominal pain, that's a non-specific symptom, because a number of things can cause it. We call it acute abdomen. It just happens suddenly, and the intense abdominal pain is crazy. Depending on whether it's a man or a woman, it can range from peptic ulcer to gallbladder issues, maybe gallbladder stones or gallbladder inflammation. It could even be intestinal problems, intestinal obstruction. It could be I mentioned peptic ulcer. It could be intestinal obstruction. It could be PID, pelvic inflammatory disease in women. It could be an ovarian cyst. It could be an ovarian torsion, where the ovaries, it can twist on itself and all that. All these are potential things that can cause severe abdominal discomfort. If you have an abdominal symptom that is sharp, it is severe, and it is sudden, and you are not sure what it is, the best thing for you to do is present at a hospital facility. Your doctor would examine you physically, send you for an abdominal ultrasound, at least, or an abdominal pelvic ultrasound. And from there, things will start getting clearer, and we'll be able to know what the problem is, and then we'll be able to direct the treatment where it should be, whether it's actually a medical cause or a surgical emergency. Because sometimes even appendicitis can present as severe abdominal pain. So it's important that you know exactly what you're dealing with, and no guesswork. That is not the time to go to chemist. That's the time to go to hospital. Doctor should examine you and send you for scan and get a precise diagnosis. That's the only way the management can be correct.
Okay. There are a lot of things people don't know that a doctor might also let you know. All right. For some persons who were saying, I want to have a contact with the doctor and all of that, talk to us.
Okay. Thank you, everybody. I'm happy to be here again, and I'm sure we've added some knowledge to what we already know. So basically, if you want to reach out with comments, questions, you can reach us on social media at Doctor's Mike on Facebook, Doctor's Mike on Instagram. You can leave your comments, your questions, and it's important for us to also let you know that we're also involved in other things that are very impactful to our society at large. We organize seminars. I was at an outreach yesterday. We organize outreaches for churches, for organizations. As part of your CSR, we can do that for your organization. And then we can organize wellness seminars, wellness checks, on-site checks, and health talks for communities, for schools, for estates, for churches, for mosque. It's very important that a lot of people are, have more awareness about their health. And then we are very big on preventive care, because it is when the problem has started already that everybody starts looking for solution. But we are more keen on making sure those problems don't even start in the first instance. So preventive care helps you to know what you need to do to stay healthy. And also our emergency response team, are also available to do basic first aid training, CPR trainings, and all these are very beneficial. You don't have to be a doctor to be able to save a life. So you can reach out to us on the handles that I've mentioned,
Yeah.
and we'll be happy to help you.
Doctor's Mike on Facebook. If you're on Facebook, doctor, you know how to spell doctor, right? All you just need to put is apostrophe S, doctor, DOCTOR apostrophe S, and then Mike, MIC, Doctor's Mike on Facebook and Instagram, and you can just talk to. There are not only him, there are a lot of doctors there. Surgeons are there.
Surgeons, gynecologists, pediatricians, any kind of doctor that you need, we'll be happy to give you, the wide scope of care that we have available.
Yeah, we did that to be able to reach out to you, and so you can have. Doc, thank you so much. We have to go. All of these questions are not the peak, eh? By next week Thursday, okay, I will treat them. You meet us here again next week Thursday. I'm sorry, so many questions here. I tell you, so many questions. But please, repeat this question on Thursday. Same time, 10:30. 10:30. We'll always do this every Thursday between 10:30 and 12. If you check your time now, we need to go for news to come in. Doc, thank you again.
Thank you so much for having me.
All right. My name is Ikami Jude, and on all social media platforms, Facebook, Instagram, Twitter, TikTok, everywhere, I am IKAMIJUDEH. It's just one word. IKAMIJUDEH. I love you all so much. And I will see you again on Thursday for Doctor's Mike. But then tomorrow morning I'll be here for News Super Review and Analysis. I'm out of here. Have a wonderful day.
Hello, sweetie, don't cry, wipe your tears.